Good afternoon. Welcome to Digital Care, 1 year into COVID and here to stay with Alan Hughes. This is the FS Club. My name's Zoe Buckingham. I'm an international marketing consultant with a background in diverse private and public sector projects. And I would like to welcome our audience here today, to thank all our amazing sponsors who are very loyal and engaged with all the various topics that we run, and to thank you, the audience, for coming and hearing Alan's talk today, which I'm sure is going to be really interesting. So I'd like to introduce our speaker properly. Alan has 20 years experience in international healthcare advisory and works alongside providers and policymakers on the latest international trends. At the beginning of the pandemic, he spoke to us on the topic of digital care, and it'll be very interesting to see how his talk develops compared to his initial thoughts a year ago. So a little more background on Alan. Alan is a panellist. He's a healthcare commentator at summits across the UK, Ireland, and the Gulf. And he's worked on a variety of different themes, including payment reform, NHSE policy and organisational development, digital care, which he's going to be talking about today, obviously, residential and acute strategy, special project and business case support to NHS leadership teams, and a variety of other topics. What's interesting with Alan is that he has both a pharma and life sciences background and a business background. So for 12 years, he worked as a healthcare management consultant and policy strategist at KPMG. And prior to this, he was in investment banking on Wall Street and in the City of London, working on 30 M&A healthcare transactions and 5 IPOs across life sciences, nursing, and acute care. He also worked on a global strategy project for Novartis in Switzerland. So he launched his own independent consultancy in 2020, which is called Liability, Healthcare Ltd, bringing insights and interim support to the healthcare market. He works in healthcare governance and has various roles in voluntary boards. So over to Alan. I'd like to welcome you all and welcome Alan, and I know we're going to have a really interesting talk today. Thank you, Alan. Over to you.
Thank you for such a kind introduction, Zoe, and it is a genuine privilege to be invited 1 year on from our last webinar to discuss digital care, its offerings, its potential, and how artificial intelligence is becoming a feature. Peter, if we please go to the agenda page. Perfect. So today we'll reflect on the June 2020 conversation and what has changed or how things are evolving. As always, we'd like to keep a close eye on public policy in terms of reimbursement and also private capital flows into exciting companies, many of which will soon be household names or are becoming household names. From there, we will cover trends and artificial intelligence applications and, sadly, the incredible imbalance between the demand for healthcare and the supply or capacity. But maybe AI will help us. Maybe AI will help address this imbalance. And also, is artificial intelligence, is that the solution to all our healthcare problems? So Peter, next slide, please. So before we jump in, what are we actually covering? So we'll discuss virtual care, so the use of video, email and interactions between clinicians and patients, imaging, so things like diagnostics, teleradiology, chat functions between clinicians and patients, lab, so pathology and reporting on pathology and testing. And we'll have a light touch cover on medical education, which might be one for our next conversation because it's an area that will see a lot of development over the coming months and years. And what we're not covering, so we won't be going into genetics or personalized medicine or detailed areas of life sciences. A year ago, I had a full pen through the data analytics, so I'm slowly lifting off the block on data analytics as we're moving into AI. But the aim is essentially to reflect on the last 12 months the role of AI and how it can help globally, and a little bit on the digital care outlook. In terms of artificial intelligence, what do we mean? Policymakers refer to AI as the capability of a computer program to perform tasks or reasoning processes that we usually associate with the intelligence in a human being. And that's, of course, subject to the appropriate protocols and processes. Perfect, Peter. So if you go to the next page, please. Okay, so I simply copy-pasted the opening page and the closing page from last June into this document to see where we were going a year ago and what has changed. And to keep this one really short, not much has changed. So essentially, digital care is helping to achieve economic resilience as all economies are slowly reopening. There's a much greater acceptance of digital care as a complementary tool, and the adoption is just accelerating into so many new areas of care. So the bottom line is still the same. A healthy economy is a more resilient and successful economy. Next slide, please, Peter. So two small edits here. So digital care was becoming more prevalent and throughout the delivery of care. But a year ago, the elective care waiting lists were worrying, but since then they have become unprecedented in all cases. So never have we seen so many patients and so much complexity and so many urgent patients on waiting lists, sadly, because of COVID, and we'll discuss that in a second. And also 1 year on, our care workforce, they're also under pressure, but many are at the point of burnout. So how can we help them with accessing patients, scheduling care and rostering care? So that's a sort of brief reflection on last year. Next slide, please, Peter. So in terms of following the money, so we've seen a much greater flow of money from, or we'll see much greater flow of money from public policy into care, but also from a private investor perspective. And so I just took 3 companies purely at random, but just ones that have been in the news recently, and looked at their valuation and fundraising of 18 months ago or pre-COVID. Teladoc, Babylon, and Ada, so a US, UK, and German player. And in terms of funding rounds, a sort of rule of thumb that was slowly appearing, say 15, 18 months ago, was a 10 times sales multiple. And there's a little bit of, is it really? Is it 10 times? Is that not? It sounds very impressive, but that's easily become the norm in the last 12 months and more recently. And if, as a rough rule of thumb, some of those companies have roughly doubled their value in terms of whether that be market value or in terms of post-money funding value that they may have raised in the public markets, or I should say private investment markets. So Teladoc is now a $25 billion company. Babylon was in the news recently in the context of a special purpose acquisition company with a $4 billion valuation. And Ada had a 100 million series raised, which interestingly was aligned with the pharmaceutical player. So the bottom lines there are significant valuation increases, consolidation and cross-border M&A is well underway, so lots more to do here. And the next chapter of digital care will definitely be more enabled by artificial intelligence. I promise, Zoe, not to take our delegates through all the companies listed at the bottom, so it's purely for reference. These are companies across the UK, Sweden, Ireland, America, and other geographies that will be the leader, are already the leaders, and will become the leaders and consolidators in digital care over the next 3 years. And I'm sure people can have a look at that in their own time on your website. Yes. Next slide, please, Peter.
Quite fascinating, actually, Alan. It's interesting to see that information.
Perfect. So in terms of answering today's key questions that many of your delegates will have joined, the 4 questions we had were, has artificial intelligence in healthcare arrived? So I'm giving that a resounding yes, and watch this space, much more work to be done. It is becoming essential in so many areas of healthcare. big data to real data. So last year we discussed a little bit on issues around quality of data, as in real information you can play with. So I think there still is more work to be done in the area of electronic health records and patient administration systems. Things are getting better, but there will be a need for more alignment, greater integration, and sadly, cybersecurity is just becoming more and more critical. So the phrase security by design, if ever was, it's just so important going forward, and especially in the context of patient data. My own an area of interest I've followed for many years is around the workforce, and so will artificial intelligence, or has it the capacity to solve the workforce challenge, as in the dramatic shortage of clinicians to look after the demand for care. So helpfully, artificial intelligence is enabling, empowering, and accelerating our workforce, but the demand for care will be relentless, and we'll talk about what the drivers have been and continue to be, but I think it'll be 2024 before we see, forgive the phrase, waiting lists that we're familiar with, but we've a tough few years ahead in terms of catch up. But thankfully, the technology is around us and we can use it. Our regulators and policymakers, they are, I suppose for context, let's not forget that most governments are very busy and very focused on reopening their economies after 12, in some cases 15, 16 difficult months. So I'm confident that they will embrace digital care and the use of AI in healthcare policy. I think it'll take time, because genuinely their focus is reopening economies and starting so many sectors. But healthcare will definitely be part of that, and policy making moving forward. So the bottom line here is that digital care aligned with the power of artificial intelligence is transforming healthcare. Next slide, please, Peter. Okay, so hopefully it's visible, but the two purple images on the left are taken from Arab Health in 2019. So it was over 2 years ago, and there are no surprises here. We have the drivers of demand in terms of demographics globally, and then we have the shortages in terms of staffing and workforce, which already pre-COVID was a huge number in terms of the need for more nurses, doctors, allied healthcare professionals, and more. So if we take the top line first and work our way across, the demand for care has been just driven so high due to the repeated COVID surges that have impacted the already significant waiting lists that were in place in every healthcare economy. And in addition to that, we have a whole year, or in many cases, a significant amount of care that should have happened in 2020 that was postponed due to COVID. So if we take NHS England as a health economy alone, in March of this year, 2021, there were 4.7 million patients, individuals on the waiting list across NHS England, and they were adding 200,000 patients per month. So it's well above 5 million now. I don't know what this month's number is, but that is a significant burden on any economy, and sadly a lot of patients drastically needing care. So hopefully digital care and AI and the wider tools available will help to access and schedule that care. So on that note, let's look at the supply of care and what has impacted the capacity and availability. So we've had significant healthcare capacity. So not every corner of the hospital or of the health economy, but many areas, obviously medicine, respiratory, A&E, have been very busy addressing the surges of patients globally. Prior to COVID, already the supply of beds was being reduced or under pressure, whether that be due to funding pressures or due to changes in service line strategies at trusts or NHS trusts and hospitals. And in terms of the actual staff and workforce, if some were close to burnout a few months ago, many are sadly close to burnout. So we need to help these colleagues with new ways of working to access and look after their patients. So in terms of the supply side, significant shortfall, and we need new ways of working to address that. Next slide, please, Peter. So what trends are we seeing in digital care, and where does AI appear? So it is accelerating and expanding across both primary care, so community and GP-led care, and then also in the acute or hospital, and then tertiary care. By that I mean the teaching hospital or university hospital environment. So we take the top line first. Digital care and AI is being used increasingly in remote consultations, and one that I've seen a lot more of in recent months is mental well-being. The wellness space is just going to explode. Disease management, so this is also a very important area for chronic illnesses, so people that may have respiratory problems, diabetes problems, and how their local physician or doctor can monitor their ongoing condition. So digital care is playing a big part and will play a big part in that space. Scheduling and staff rostering. So this is where we're using the technology to, I suppose, access and deliver care, helping the clinicians to access the patients. And then in terms of diagnosis, the use of telediagnostics and home tests, where the patient can actually send in a sample or a scan or an image to the relevant clinician. So their areas, and also, of course, online prescription. And in the hospital environment, emergency care, so things like triage and quicker assessment of records, subject to the quality of the records and so on. Patient portals, discharge management, also seeing a lot of use of digital care. Robotic surgery, this is another fast-moving area in terms of helping the surgeon in the operating theatre. Digitization, and then general care innovation. So while digital care will never replace the physician or the clinician, it will certainly assist. Next slide, please, Peter. So is artificial intelligence to the rescue? Here, this is from it's a Europe-wide technology review that was commissioned by where McKinsey led this work about 18 months ago, and the findings were that certain areas of care will embrace or can embrace digital care more readily. So they will be areas like teleradiology, so diagnostics, the wellness self-care monitoring that we went through a minute ago, and triage. And slowly, as you move down the numbers from 1 to 8, you'll see there's a greater involvement of a person, a clinician, because obviously we can only support and help with technology, but there are points where surgery now, in fairness, we're seeing a lot more robotic surgery coming in, but I think it'll be a while before those areas see as much change as areas like teleradiology and the top of the table. The image on the right hand side, so the segments, I won't go through each segment, but the idea is that each one of those segments is embracing technology in different ways. So at present it's around how can technology help those segments, but the big one is the integration along that circle. So at present it's quite targeted in terms of helping each area of care. So the next thing will be, how will these areas integrate the care pathway across them? So it's here, and it will only increase in terms of the delivery of care. Next slide, please, Peter. Okay, so I tried to create an image that would bring together the last few messages around the application of digital care and putting it in context, in this case, an NHS England context of the 5 million patients. So areas that are in no particular order, but I think radiology and diagnostics is a key one, to help our health economies with addressing and prioritizing patients across those waiting lists. Then you have the triage and preventative care. And then, of course, the aftercare and rehabilitation. So if there's a greater demand for beds and access to hospitals, there'll be an even greater need for monitoring and supporting those patients after they leave, in case the length of stay reduces, or there's the aftercare that one would normally have access to is under greater demand. And then, as mentioned, the disease management space that we covered earlier. Will we see normal waiting lists by 2023? I hope so. The Royal College of Physicians says it's going to take at least 2 years, might be longer, but at least we have some tools at our disposal to help to get there. So as a closing point on that slide, it's care access and efficacy. So the efficiency and use of the clinician's time can be enabled with the appropriate application of digital care and AI. Next slide, please, Peter. Okay, so we're coming close to the end of our 20 minutes. What does it take to survive, and what is important in terms of innovation? So the operating models of the companies that provide these services is constantly evolving, and some may have started in a back office or maybe a solution provider area to care. Others might have gone straight for clinical support, so maybe offering video consultations, to the more front office, as in just exclusively building relationships with patients and maybe owning care and developing relationships, replacing the family. Not that we would replace the family physician, but the idea being that some companies are going after certain areas of care and providing care directly. But from a technical and operating perspective, the tech stack, is a phrase that just keeps popping up, is growing taller and wider across that area of vertical and horizontal integration. What does it take to survive? So this was something that we discussed a year ago, and I can come back to what has changed. But at present, what's most important is for these companies to have the product breadth and ability to be flexible with the different health economies, and then connectivity and integration. I referred to that segment a few minutes ago around which areas of care are using digital care, but how will they integrate with each other along the pathway? So lots of work and development there. And also how these providers of digital care solutions, how they build relationships and align with the traditional payers of care, so governments and private medical insurers, PMI, will be key, because they hold the purse strings, and usually the largest purse strings. So there'll be a significant amount of dialogue needed across traditional payers, or there is already. Cybersecurity. So traditional care provider requirements in terms of cybersecurity are under incredible scrutiny, and I don't need to mention some of the attacks that have happened globally in recent months and years, even during COVID. And the digital care companies, so these private companies, their requirements are changing daily, weekly. So security by design is part of that, but those security challenges and cybersecurity challenges will continue to be very important and will need constant monitoring. Digital care. So the propositions that these. Yes.
We're just coming up to the time to switch over to Q&A. If you're okay to just finish up, if that's okay.
Yeah, you gave them 25 past. Yep, super. So these companies are enabling digital health companies, competing with legacy care providers, so the traditional providers of care, and then enabling legacy providers of care to do more work. And so on that, hopefully that brings together where we were 12 months ago and some of the observations since, and might see you in 12 months and see how things have evolved. So thank you very much, Zoe.
That's wonderful. Thank you, Alan. Really fascinating. So we'd obviously like to transition over to Q&A, because we've got some really great questions in as well in response to Alan's presentation. I just wanted to mention that the slides are available for download in the chat and on the website. So you'll have access to those, and also a recording will go up on the website. So there are plenty of opportunities to refer back to what Alan's been saying. So on to the questions that we've got. They've been quite interesting, actually. Harvey Shipper, Alan, has been asking, how does one address the cross-jurisdictional licensure and liability concerns? I mean, I guess that's an interesting question, isn't it? Because these companies are international. How do they fine-tune their products and services to work with local healthcare providers?
So I think, my starting point would be that healthcare is a national game. It's each healthcare economy has its own payer, its own regulator, its own medical education system. So it's each conversation will start possibly with a familiar element or a familiar solution, but I think most digital care companies would recognize the need to customize their solution to the local payer and regulator. Healthcare is one of the most, if not the most, regulated sectors in the world, and as a result, it involves quite a bit of customization across areas such as regulation and delivery of care.
Wonderful, thank you. I'm interested as well, Alan, in how do the AI technologies that are being developed connect up with IoT devices, for example, for healthcare management? Our governments, for example, is the NHS looking at giving patients IoT devices that could connect up with some of the systems that they're working on?
I've seen local governments, so county councils across Scotland and certain parts of England, following that Internet of Things trend. So I haven't seen it at a national level, but at a local government level, yes, you're right. In areas of social care, monitoring patients that might have chronic illnesses, maybe the elderly frail, there would be instances where you will see the use of Internet of Things and monitoring devices. How they integrate with the local government's platforms, I'm not familiar, to be honest, at a local level, and dare I say that might depend on how each local government organises its social care. But it's definitely an area that we will see more of in the context of disease management, Zoe.
That's interesting. Are there any particular companies that are forming alliances, would you say, or is it still quite an open playing field?
No, I think the majority of the companies that I listed will realise that to gain market share and access to patients, it is through the payers. So either the governments or local governments or private medical insurers, that is the way to access patients. So most of those companies that are listed will be engaging with the payers of care, or either with those organizations such as hospitals and sometimes existing providers of care, and then I suppose supporting them. So you will see a lot more of that in terms of building relationships with patients.
That's interesting. Bob McDowell, one of our members, has asked, is AI a buttress to resources rather than a leadership force in healthcare? So I guess he's trying to understand, is it a kind of a filler just to get us through a crisis, or is it something more strategic that's actually going to improve diagnosis or healthcare support?
Yeah, in certain areas like diagnostics and I suppose preventative care, it is an enabler. At present, it will be used as, if we use that word buttress, it will be used as a support for now. But as we become more familiar with how clever and how useful and how accurate it can be, it is expected that it will stay, because well, I don't know, it'll be around for at least the next 3-4 years, and I think sometimes those ways of working become the norm. Will that be the case in every area of healthcare, Bob? I don't think so, but certainly in some of the areas we went through in the document. So I appreciate I haven't given you a holistic answer, but definitely in certain areas it will become a buttress and a longer term support.
I imagine it must be quite a good aid memoir for doctors, because they have to remember a huge amount in terms of symptoms, don't they? So anything that helps them is a real benefit. Another question that we've had that's come in is about what has changed in the success characteristics for digital care companies compared to when you were talking to us 12 months ago, what you thought sort of marked success then compared to now.
Perhaps, I think 12 months ago, if we take a rough rule of thumb, that some of the companies were worth half of what they're worth now, and sometimes even less. What they needed to grow was sufficient funding. So those companies had an enormous demand for care solutions from every corner of the health economy. So they needed capital, they needed resource, software engineers, bright minds and capability to develop solutions. So a well-funded platform was essential prior to COVID and during COVID, because of the need for a quality solution and the aspects involved. So those that didn't have adequate funding definitely would have raised money in recent years and months. And then in terms of the difference now, it's those companies that have had, let's say, that have developed their management teams, they're now able to move into more areas and develop with almost in partnership with the different healthcare economies that they're supporting. So in summary, we've moved from the need to raise capital to now access talent, and the next one will be generating the next set of solutions.
Yeah, interesting. So what are you seeing on the international government policy front with regard to digital care? What do you think is coming up? What's the next big thing?
So I'll caveat this one with the fact that most governments are still trying to open their economies. So I don't think digital care and AI is center of the table. But as economies reopen and as the incredible waiting lists continue to be managed by different healthcare systems, we will see a greater involvement and recognition of digital care. If I was to give examples, the German healthcare system, obviously it's a massive economy, 90+ million people. They've introduced two digital laws. One was pre-COVID, and one was since COVID arrived, around to encourage hospital doctors to include the use of some of those Internet of Things and apps in the pathway as they discharge a patient from hospital. So it's an area that we will see increased government involvement and sponsorship of digital care. That's just Germany. Another area is even in the NHS, we're seeing a lot of encouragement for private sector companies to continue supporting and helping hospitals. So it's an area that we will see increased involvement, but I sense the focus of government will be to reopen economies, and then hopefully, Zoe, they will embrace more digital care.
It sounds interesting. There's been a lot of talk in the Middle East, hasn't there, about embracing technology in relation to healthcare. So perhaps that will be another area, geographical area, where that could become quite significant.
Yeah. So I think the most of the health economies in the Gulf have considered it. I sense that similarly they are challenged to try and reopen, and given they're probably so dependent on international trade and travel, I sense it might be similar there. But you're right, they will embrace digital care in many of the geographies of the Gulf.
Yes, interesting. It's a very different kind of environment, isn't it, with a big focus on technology. Bob actually McDowell has asked another question. In what areas will AI require licensing by medical authorities for its application? So is it going to be a bit like the actual pharmaceuticals, where you have to get them licensed because obviously they're going to impact on people's lives, aren't they?
I think, how do I answer that one? I suppose, yes, the appropriate protocols and processes will have to be rigorously followed. It won't be a case of plug and play solutions to address these very critical patient needs. So the regulation and monitoring of these tools, it's not in chapter 1, it's definitely well developed, but it's definitely an area that will see more and more support needed at a national and policy level. I can't confess I have been involved in any of the legalities around that, or the background to the regs, Zoe, but that would be my sense.
It'll be an interesting area. It's definitely a good discussion topic for the future. Yeah. I think the impact of the quality of the technology and the way it's programmed, the safety. So yeah, another interesting area to look at.
Definitely, yeah. I think future areas that we didn't cover today that will be that will sort of follow will be medical education, because if there has been so much change in the delivery of care and how patients access care, how is that impacting how the next generation of clinicians are trained, or how hospitals are managed? So medical education, I think, has a big part to play, and I'd say probably more than many realize. So that's an area I sense we might need to chat more about in the future. And then aligned to that would obviously be the regulatory and some of the points that Bob raised a minute ago.
Absolutely. Yes, you can see that evolving, and perhaps the doctors of the future needing to learn how the algorithms work and what to expect from them and how not to tell them the wrong thing. So yeah, fascinating.
Exactly right.
Great. Well, we're approaching the end of our occasion, so I'd just like to ask anyone who's got any last questions to pop them in the chat as quickly as they can. And I think that what you've said is very interesting because of also your connections with the city. And what kinds of things do you think investors are looking at, and what areas do you think they're maybe not aware of that they should be aware of in this field?
So by investors, I suppose we can divide them in two. There's the institutional investors and professional asset management and so on, and then we have private individual. So the more professional and institutions will have, I suppose, the research teams to look at some of the points that we discussed today, such as regulatory and policy and the demand and supply side. If we look at the demand side of care, it's unprecedented, and we don't need to be coy. There's an incredible demand for care, and will be for the foreseeable few years, and that's across every area of those elective waiting care lists. Sadly, the supply of capacity and the clinicians to look after those is the shortfall. So it will be and continues to be a strong area for investment. The winners will be those that have the adequate and relevant, I suppose, delivery mechanisms to provide care. That'd be my take in terms of that balance of demand and supply. So the winners will be those that can address the need appropriately and sufficiently.
Do you think that some of these technologies are actually going to help shorten or minimize the need for human intervention? I mean, obviously, we've talked about the diagnostic aspect of that, but what about at the more kind of nursing end of things? Do you think that AI or digital care has the ability to kind of speed up some of the day-to-day processing and take the weight off some of the NHS or medical workers in other countries?
Yeah, no, absolutely. There is an opportunity to lighten the burden, whether that be through reduced paperwork or accessing information, triaging and monitoring. So the average length of stay, and that I'm not sticking to the traditional inpatient definition of average length of stay. You will see that continue to shorten. But also in an outpatient and day case environment where the patient arrives and those diagnostics will be more available and the technology is there to access them and give responses more quickly. We've seen incredible innovation in the last 12 months in terms of turnarounds with tests and how things can happen when we try really hard. And obviously it was an incredible time for clinicians to be involved, and we obviously have to take our hats off to the incredible effort. And I see a lot of those innovations being here to stay. So yes, some of those lengths of stay and patient interactions will shorten, and hopefully in the right way, and not at the expense of care.
Absolutely. Well, that sounds so interesting, and it sounds as if we're on the edge of something very exciting that's going to make our visits to hospitals smoother and quicker, and also reduce the potential for a misdiagnosis or a lost disease that all the doctors may have kind of read about in medical school but not seen for a while. So, I mean, there are just so many different aspects to this. It's fascinating, and I'd like to thank you for your time, Alan. You've given such an interesting insight into this area. I hope we'll be able to have you back again for further insights.
I'd love to.
I'd like to wrap up by thanking our very loyal and wonderful sponsors who are from so many different areas. And I think this is what's great about the FS Club events, bringing together people from industry, from finance, from all around the world, and that's so helpful. And so thank you to the audience, which is also similarly diverse. We have some really interesting upcoming events, as you can see here. We're never afraid to embrace the slightly kind of radical thinking of changing the world one mistake at a time, post-pandemic, the importance of corporate reorganization, the usefulness of useful knowledge, and Europe and China and how those capital markets can work together. So I'd like to thank our speaker, Alan Hughes, for all the time and effort he put into such an interesting presentation, and to really direct you to the FS Club website, where you'll be able to find Alan's presentation, which will be recorded and placed there. So I hope you all have a wonderful day and look forward to seeing you again soon.
Thank you. Bye-bye.
Thank you. Bye-bye.